welcome to the demo to everybody, and I will hand it over to let Chris take it away.
Thanks, Lindsay. It is wonderful to be here. Thank you everyone for joining. Chris and I are super excited to talk a little bit about automating financial clearance for our friends here in the ASCs. So we'll cover today, really, let's talk a little bit about what financial clearance even means and what that is. And then we'll talk about the impact of automating the entire process, the steps that we should be following internally. Chris will take you through a demonstration of those 5 repeatable steps, and we'll save a little time at the end for Q&A. If you have any questions, feel free to drop them in the chat as we go along, and we'll get to those, hopefully all of them, right at the end here. Just so you all know, this is going to be recorded. You can request a copy of it, and we'll get that over to you. We want this to be interactive, so again, please feel free to drop any questions you have, comments, whatever it may be in the chat there. And like I said, we'll get to those at the end of the session here today. My name is Chris Finelli. I'm VP of Business Development here at HST. I actually came from a company called Clarity, where for 5 years, that's all we did was really stay hyper-focused on cost estimation and entire financial clearance process. So if I'm asking myself right now, what does financial clearance really even mean? I would simply sum it up just saying everything, all the processes, everything that you need to do in order to ensure that you're going to get paid both by the insurance carrier and the patient. Simply, I think that's it. Everything else is kind of fluff, but our focus today is everything that you do pre-service to ensure that you're going to get paid exactly what you're owed by all of the responsible parties. Joining me, most of you probably already know Chris Pompilio. Chris is our senior sales engineer. He's going to be the star of the show today. He's going to walk us through the application, and he's really a great resource. He's been in this industry for 25-ish years, and I don't think maybe not quite 25, unless he started when he was 7. But he's been a tremendous asset for a lot of our customers, answering any questions, not only related to financial clearance, but anything in ASC revenue cycle, electronic health records, reporting, etc. Again, we're just going to be talking about automation and how that benefits surgery centers today. But first, we'll start with an overview of how most facilities are performing these operations today. And we'll be answering the question, how do we deliver a thorough financial clearance process without all of these manual and time-consuming and repetitive tasks? So there are 3 approaches really that surgery centers, CBOs, and ASC billing companies go through today. We've talked to hundreds and hundreds, if not thousands and thousands of revenue cycle operations in these facilities. And if you were to bucket it up in 3 different approaches, the first one is a very manual, it's very thorough, but it's a very manual process. That means they spend a lot of time, have a lot of full-time employees, a lot of resources that they dedicate to performing eligibility and verification, running financial cost estimates, and delivering those financial estimates to patients, and hopefully collecting from those patients pre-service, or at the very latest, the data service. The second is a little less thorough, because let's face it, a lot of facilities don't see the entire benefit of employing folks in order to do that manual process. You know, is the squeeze worth the juice that you get out of it? So it is a little bit less manual, but it's also a little bit less thorough. So maybe just employees are checking eligibility and verification, probably not calculating the cost estimate, maybe collecting a copay or a portion of a deductible on the data service. The kind of the takeaways there are that you're not spending as much time, but you're certainly not collecting as much on the front end. And then you're incurring some costs on the back end trying to collect from each and every patient. And then that third bucket is maybe you're outsourcing to, if you have a CBO or if you have an ASC specific billing company, maybe you've elected to have them perform those services. Typically, the average cost to do that is about 1% of net collections. So the good thing is that, they're typically pretty thorough. However, there's a pretty significant cost to the facility for them performing those operations. So let's talk a little bit about what facilities have done historically and even currently, and what those steps are in order to go through a full financial clearance process. The first, again, is really eligibility and verification. It historically means going to payer websites, making phone calls. Maybe you're using a clearinghouse like Waystar in order to pull those patient benefits into a system. The second step is that you're calculating a cost estimate. So a lot of facilities have spreadsheets set up with all of the procedures that they perform, the CPT codes, and then the allowable amounts with their payers. And that's challenging to keep up with the spreadsheet. And it's also like you need an advanced degree in mathematics in order to calculate those cost shares. There's authorization, which is generally started in the physician office, but quite clearly needed in order for you to get paid on the back end. And then there's the patient communication piece of it. Once you have that estimate, it's communicating pre-service and articulating what the patient's financial cost share is so that they're comfortable with it and willing to pay you. And then the last step would be actually collecting from the patient. We always encourage folks to do it as soon as you can in the process. It's much easier to collect pre-service than post-service. You can't take back a knee arthroscopy or a tonsillectomy or anything like that. And it's amazing how many patients can find the funds to pay for their service before it is actually performed versus after. So HST really recommends automating this entire process, and not just bits and pieces of it, but if you can automate the entire process, you'll recognize a couple of key and distinct advantages. I always say with automation, it should accomplish at least one of two things. One is create a ton of efficiency. And when you have efficiency, you're always lowering costs. So that's a good thing. And then the second thing is improving the quality of the product, right? So if you create a ton of efficiency and you don't really improve the quality of the product, it's okay. You just have to look at what your cost savings are and then determine if it's a good fit for you. But a well-automated process will improve both of those aspects, right? It'll create efficiency. It will also improve the quality of the product. And in the case of the financial clearance process, it'll typically do a third thing that most of us, I don't believe, really think about, and that's improving the overall patient experience. So pre-data service, again, it's running that eligibility and verification, hopefully not just once, but hopefully a couple of times to ensure that at the time of scheduling, you have a cost estimate for that patient. And maybe if they, pay another medical expense, that their deductible is updated and any effect that that has on the cost share is updated for that patient as well. It is using progressive estimation to create a calculation for their cost estimate. And progressive estimation is a term that we coined, meaning that if you're maybe an ophthalmology center or a pain center and performing multiple cases on a patient, that when you're pulling that patient's benefits, you're applying their cost share for that first case towards their deductible for the second case, just meaning that you're not over collecting. It's a pain to have to go back to a patient and ask for more money post-service, but it's also kind of a pain to refund that patient. They're not always excited to get that check in the mail. They're wondering why you held on to their money for so long. So we got to get it right the first time. You have to deliver that estimate, and not just deliver it, but deliver it in a way that's consumable and digestible to the patient so they understand what their cost share is. And then, of course, we want to collect. And as I had mentioned, if you can collect pre-service, that will do wonders not only on your accounts receivable, shifting that AR from post-service to pre-service, but you'll improve your collections overall as well. And then if it's the data service, that's okay, but we probably want to know from the patient how they intend to pay if we're allowing them to pay on the data service. All right, so when you're using HST Clarity along with HST Pay, we're going to automate that entire process for you, from the eligibility and verification all the way through the collections from the patient. So in the HST approach, we're going to automate the eligibility pull right off the bat. At the very moment that case is scheduled, we have a number of different sources for eligibility. We've got screen scrapers for those payers who like to hide information in comments fields and free text fields. We're going to package it up so that you always know where certain information is. And we're going to use that information to drive a 98% accuracy in that total cost estimate for the patient. We're going to do it at the time of scheduling. We're going to do it at the first of the month, just in case that person no longer has active coverage. If they don't, we're going to send you an alert saying, hey, patient Jones scheduled for their procedure. They went from active to failed on this automatic second pull. And then we're going to check it a third time automatically as well. Just because patients pay those medical expenses, it lowers their deductible and has an impact on the cost share at the facility. So if that's the case, we will automatically send them an updated estimate as well. This is done kind of behind the scenes. There's nothing that you have to do. Everything is performed automatically. And I don't use that term loosely. It does happen automatically. That happens for you. We load all of your payer contracts, your charge master. We know any implants cost by surgeon, by case, and we're calculating a to the penny accurate estimate so that there's no ambiguity, there's no room for interpretation. The patient receives that estimate, they know exactly it is what they owe. And it's, like I said, more than 98% of the time it's spot on. Really, the only time that it's not is if perhaps they did make that payment to another medical provider and it hasn't hit the system yet. Authorizations, we can do some limited authorizations checks for you. This is a tricky one. This is the thing that payers really push back on. They do not want to provide any response to our electronic requests because they're always trying to find a reason for a denial. That said, there are a handful of payers that if it's been initiated, they'll provide us that information, and we'll always give you a workspace so that you can track those authorizations as well if they don't respond. We'll provide all of the patient communication, and not only that, but it will be audited. So you know exactly when that estimate was sent, when it was printed, if it was printed, and most importantly, when it was opened by the patient. And then we'll facilitate all of the payments, including payment options. It really, we're taking what in that first bucket, that first approach, that very manual approach that facilities are doing today, that might be 30 or 35 minutes per patient. We're shrinking that down to, I don't know, maybe 3 or 4 minutes in total, probably less. And we do realize that the easier, more concise, more digestible it is for the patient, and the easier it is for them to pay, the more likely they are to pay. If you offer an online payment option, you'll see patients 35 to maybe 38% of the time will just go ahead and click pay when they receive their estimate and pay in full. That means 38% of the time, you never have to worry post-service about sending them a statement, making a phone call, sending them to collections. Keep in mind that another percentage of patients will choose to pay on the data service, or they'll elect to pay by phone. A lot of facilities are collecting over 90% pre-service from their patients. And to kind of support that, the urology group is a customer who I worked with years and years ago, sat down with their CEO. This was relatively, disruptive technology. It was new to the market. And he was kind of forward thinking. And he just asked the folks there, he's like, what are we collecting from our patients? And they didn't really know what percentage they were collecting. So he asked them again, and then he said, hey, I want you to pull some reports, and I'd like to take a look at this information, because if Chris's product here can do what he says it can do, I want to know what impact it would have. So they pulled some numbers for us, and the CEO said, all right, we're going to give it a shot. And if you look here, we've decreased a ton of time spent on their entire financial clearance process. The big thing is they were sending about $1.1 million annually to collections, and it's less than half of that now. So they are collecting over $550,000 more from the patients year over year than they were before using our product. And they still have a little room to grow, but that's neither here nor there. This is one of the very many success stories that we have with our financial clearance tool, HST Clarity and HST Pay. So Chris Pompilio, sorry for going a minute over or two. I'll turn it over to you.
Yeah, no, thanks, Chris. No problem. A lot of good stuff there. So let's talk about what it looks like for the user and what you guys are going to see when you're in here. So let me go ahead and share out my screen. Have popped up there now. Is it sharing out there on your side? Awesome. Okay, so HST clarity, right? Everything Chris said is viewable in here. What we're looking at here, let's kind of orient everybody to the screen for just a quick second. It is browser-based. What that means, browser-based user interface, right? Chrome or Edge or Safari, if you're using an Apple device, that's fine. We're sort of device agnostic, if you will, on that side of things. Simply log in, and you'll see all the patients that are coming from your schedule in HST right in here. As Chris said, nobody has to do any kind of duplicate data entry to get that data in here. And literally within minutes of that patient being on the schedule, Clarity has gone ahead and verified their insurance, assuming everything is active, and pulled back in the eligibility and benefits and readied that estimate to go out to the patient. Again, can't overuse that word automatically enough. At that standpoint, it has done all that through those different avenues Chris described. And this is what you're seeing in here when you're looking at a list of patients. By default, this list is going to show you kind of a 2-week time frame going forward, but you can expand it or go backwards in time, look at whatever you want to in here for those cases. In my test database, we just have a handful of cases on the schedule, but I could filter this list even further, some advanced options here. Maybe I just want to see ones that were not verified. Ones that were good. I don't need to do much with those, but the ones that weren't, I can look at those, or maybe even canceled cases, ones that have a payment due or a zero estimate. Any of those aspects can be a filter for the list that you're looking at. As well as you have the ability as a user to go ahead and kind of configure what you see in here. All the columns that you see in here and the order of these columns, that is all your domain as well. In fact, you can toggle certain columns off or on if you don't care about the patient's birth date or things like that in there. You have that information in there as well. So we have all that information showing up for you here with those patients. Most of these are active coverage in here. You can see on some of these. We've taken the liberty of changing some of the names of some of the information in here. Some of you who are vintage TV fans now, can I say that? Is Cheers a Vintage Show may recognize some of the names in there. But if I wanted to see what the eligibility was on any of these patients, I can go ahead and click on the green active coverage. It'll go ahead and open that information up for me in there. If it didn't do the eligibility or was not able to confirm it, it would simply say failed in there. And when I click on the red failed, it would take me and show me exactly why it failed. It couldn't find the patient, or maybe it was a lapsed coverage or something like that. As Chris mentioned, we're getting this information from a lot of places, but we're always going to show it to you in a nice little easily digestible format. We highlight the areas that are important. It's active coverage. There is no co-payment here on this one. There's a 20% co-insurance. We do have a deductible remaining on this patient in here, the out-of-pocket max, etc. And then it'll also show you, now we did this on purpose, but it will show you if there's some information that you have in your system that, or in HST, that is different from what the payer has. In this case, on my patient here, we had him in here as Pierre Andre with an address out here in California where I am. The payer came back and said that we actually have him just as Pierre, and here's an address that we have of his in New York. You can update that into HST if you want to. We don't update that automatically today. It's actually by design. You may have better information than the payer does, so we don't necessarily do that for you. But we've taken all that information, we've taken those data fields from the eligibility and benefits, and we've pulled them into an estimate for that patient. So if I click on one of my patients here, I'll pick on a different one, Carla in this case, and go look at how that estimate was calculated out. We have our contract in here. The eligibility is there again. There's our charge master. There's our allowed amount. It's taking into account her deductible and everything else, and completed a patient amount due in there. And then from here, you can send this out to the patient. There's a little send button down here. I just did this a little earlier today. It can go out via email or text to the patient. When that email goes out or that text goes out, no PHI. It'll be from you guys. In this case, where I'm Maple Valley Surgery Center, I had a little email went to myself here, and it's branded from you, upcoming procedure. Here's a click here to view your estimate. They can unsubscribe to this. There's a web page link in here as well. So you can kind of configure what this email looks like, or text. It's putting kind of the same thing on a text message, but that's what the patient will get. They'll click that link. It'll take them to a little landing page where they'll be able to say, click here for facility fees. They'll click there, they'll type in the patient's birth date, or their own birth date in that case. And then what they'll see is something that looks just like this, right? We can brand it as you with your logo on there for the individual centers, patient's information. You control the verbiage in here, what it's going to say, but basically, the typical thank you for choosing our surgery center. For questions, call us. Here's our information. Here's the procedures we're using to do this estimate. Here's what the insurance allowable amount is. In this case, it's pretty much all the patient because they haven't met their deductible yet, but we will break it down for them by co-payment, deductible, co-insurance, the amount you want to collect in here. And then you have a choice down here, these little buttons. We can configure these, or we can help you configure them if you want to have them on there, first of all, and then if you do, where they're going to link to. So it may link to, financial assistance, a care credit or smart card, or maybe an FAQ page on your website for that patient. The pay by phone would be your information to call, or pay on data service would be, what you accept at your surgery center. They're going to make that payment. The pay online, that's where we can link to the HST's payment portal called HST Pay. It's powered in the background by Global Payments. The nice thing about HST Pay, if you choose to use that one, it is optional, but you absolutely can. It'll actually post that payment or create and post that payment back in HST Practice Management. So all that information is there for you. All this stuff happened. All this stuff was ready to go without doing anything except scheduling the patient. Literally all that was done on the front end was schedule that patient, and that's in there. It is fully compliant with the No Surprises Act. If it's a self-pay patient, we can calculate the same estimate out for that side of things, and the patient can translate it into whatever language is their common language. If they're not a strong English reader and they want to see it in Spanish, there it is in Spanish. Same exact estimate, same information, same functionality for that patient. So all in there as well. And let me go back to my case estimator. The other couple quick nice things in here about that estimate when it does go out to that patient is that the patient has seen the estimate. I'll repeat that, right? The patient has seen the estimate. How do we know that? Well, because they clicked that link they got in their text or email, and they went ahead and they typed in the patient's birth date, right? That is kind of our read receipt, if you will. Think about it from kind of that standpoint. In my list here of patients, on my far right here, I have the delivery method. Most of these have been viewed. Some have just been sent, not viewed. Some have not been sent yet. So you'll see that status there. And if you click on the viewed in here, for example, it'll show you that text, who created it. So my partner, Chris, created it, the message in here. Who created it? Chris did. He printed it earlier today too. I sent it out by text and email here, and it was viewed by the patient today as well. So you see that full history there. And then if the patient made any comments or chose any of the options in there, what they did as well. So a full audit log on the printout. That it also has this information on the printout the last time it was viewed. So if that patient is coming in on that data service, they're going to make their payment there. You can slide that printout over to them and confidently say to them, "Hi, welcome in, Carla. Here's that estimate we sent to you on Wednesday, and you viewed at 11:56 a.m." So automatically just de-escalates that conversation that nobody likes to have. The patient feigns ignorance. They never saw an estimate. Yeah, we did send it to you. You did view it. So they know they did too. So it just makes it easier. And you can take that payment right there. Talked a little bit about the demographic conflict. I will see that in here as well. If I click that, it would show me what that demographic conflict is on that patient. There it is again on there if I want to see that. Chris had mentioned too the progressive estimation in here. There's on that one as well. If I look at that estimate in here, it's going to tell me, even though this is currently his deductible remaining on the little progressive estimation, it'll tell me that's actually 0 because we know there was a previous visit in HST for this patient recently that has eaten up that deductible. It just hasn't hit the payer yet. Maybe we haven't billed it. Maybe we scheduled both those cataract procedures, left and right eye, at the same time. That second visit estimate is going to be accurate in there for that one as well. And have that one in there. So all that information is coming through in here. Now, I know this is obviously a different user interface than what you're used to in practice management today. For those of you who are using HST's practice management, does this mean I have to go in, Chris? You're telling me I have to go back into practice management and enter all that information back in there? Please say that's not true. It's not true, right? All that information is absolutely flowing back into practice management. In fact, if I were to open a patient in there, and I'm going to come over here to a previous patient in my test database, Jack Limberg, I'm in his insurance here in HST practice management. Once that patient is scheduled, and assuming it was validated and verified by Clarity, it's going to check that verified box here for you automatically. So we know it's to be done in here. It's going to tell me the date it was done. It's going to tell me it was through Clarity. It's going to show me down here in the bottom where it says benefits information, all of that information we saw earlier in Clarity. So the estimate that went to the patient, right there's that information that the patient saw it. Demographic conflict. This one came back and said, actually, we had Jack as Jack as the subscriber in HST, but the payer came back and said, actually, Jack's the child and Anthony's the subscriber. And that information in here. Again, eligibility and benefits in here. If I scroll all the way down, it's going to show me the calculation plan, how we calculated that estimate out to them, what the percentages were, deductible applied, co-payment, etc., on each one of those. So all this is read-only here in HST practice management, but it is there for you easily to see. It does fill out those specific fields, like the verified checkbox. It's checking that box for you, who did it, and it was through Clarity. It also, cancel that. It also will fill out in the visit, and this field is also available on the appointment sheet in here, the amount due on date of service. And this time, this patient, the amount paid in here is in there on this one as well. If I were to go look at Jack's account because he paid through HST Pay on that account, and poor Jack in my test database has far too many visits, but I can see that payment is in here and it came in through our payment API right there and automatically attached to the patient's account. So full round trip of that information. And then finally, when you're in Jack here and you're on Jack's insurance information in here, there's a little access Clarity button that will simply just click on that. It'll take you right back to that patient in Clarity. And of course, I'm on a different screen here, but it'll take me right back to that patient and open them up. So on that full round trip. I think we have a fairly large group here today. I don't know. I saw some messages popping up. If there are some people who had questions in the chat, we reached the end of our time, but I have time to hang out for some questions and comments.
There's a couple of questions, Chris. I think that would be worthwhile if anybody wants to hang back for a second. One of the first ones that popped up was uploading contracts, the payer contracts, into Clarity.
Yeah, so as Chris kind of mentioned, he breezed over it a little bit, but we will do that as part of the implementation process, right? We can load those contracts for you. I say for you, it's really with you because we show you how to do it as well. And you can update and change those. You don't need to come back and be beholden to HST for that. They're very similar to the contracts you may have today in practice management. They are two different screens today, full transparency. HST is working toward having a singular place to enter contracts, what would flow over to all encompassing HST products. But in the initial implementation process, we'll do some more of the heavy lifting for you on that.
Great. And then another one, is there a way to automatically send the estimate, or does the facility have to do the sending it out?
Yeah, great question. Absolutely, you can have it automatically go out. A lot of centers do like to get a set of eyes on it, but you can absolutely have it sent out right away. Depending on what the cadence is of you scheduling cases, you may want it to go out a certain number of days prior to data service. That's a possibility as well. And you can kind of take a hybrid approach. You might say that, hey, you know what? These certain payers and these specific procedures, Medicare, colonoscopy, it's pretty simple. Send that right away. Other ones, don't send it, put it on hold, let me look at it before I send it out. Not me, but you, obviously the center's doing that. So yeah, we've kind of taken that same approach as you would at your center.
And then one more, it's kind of a two-part question a couple people asked. How does it work with third-party vendors? One general and then one about Waystar. Can you partner with other vendors when using this tool?
So when you partner with other vendors, for instance, I'll answer the Waystar part first. Waystar is one of the sources that we're pulling the information from, as you may experience if you use them today through practice management, or maybe just go to them for their real-time eligibility. It's great for the payers that they communicate with, but they don't do all the payers, right? Because of that, we use Waystar, we use Availity, we use the payer portals. We're pulling the information from the best place that we know to get it from for the individual payers for different parts of the country. So we do and you don't need to contract with all those different payers and just pick one. We're doing it through using HST Clarity behind the scenes with all that. You'll still have your payer, your clearinghouse that you use for claims processing and ERAs and that type of thing. This will be separate, different. You don't need to recontract with them for that. As far as other vendors, if they're asking about, sometimes I know some HST clients maybe are not using practice management today. They may be using another practice management system. We do have integration with a few of those. Usually it's one directional, meaning it's pulling information, the scheduling and insurance information from your scheduling system into HST Clarity. And then, of course, doing all the great stuff we talked about today, but it may not send that information back to that. So you'll be working in two systems at that point. Within HST Clarity and practice management, it's a full circle.
And Chris, I maybe took that question. I mean, partnering with other payment processors.
Oh, okay, yeah.
In which I was thinking, there are literally hundreds of available processors on the market. So we have Patient Notebook, which is part of Waystar. They're the biggest in the market. And so we partnered with them. We do have full integration on the Patient Notebook side. But then we have HST Pay as well. And really, those are the only two that are going to have any kind of integration between Clarity, the portal, and then PN.
True. Yeah, that link when I was looking at the patient earlier in here, and I was on Carla, right? So I was on Carla in here, and I looked at Carla's estimate, and and the patient is looking at this. Oops, I didn't want to print that out. Sorry about that. Patient view, there we go. And the patient chooses this pay online button. That will link to whatever you need it to link to. So
this one's connected to Notebook. So if you want to click on it, it'll. The nice thing about it is we know that if there's integration and we're making it easier for the patient to pay, that improves their likelihood of paying. So you'll see here, Patient Notebook and HST Pay, that information flows directly into that payment portal automatically for the patient. Again, just simplifying it for them. They only have to put in their payment method and click submit.
Exactly. Other ones, it may open like your generic online patient portal where they put all their information in and then they make that payment and you're reconciling those payments back into practice management, for example. But we have centers working with several different, credit card merchants or online payment ones. But yeah, the two preferred ones probably would be Waystar's Patient Notebook, and then now that HST have their own HST Pay, that will automatically post back to practice management without having to do anything else there as well. So yeah, thanks. Sometimes those questions, we all hear the same question and we have a different answer. So that's perfect.
Yeah. Okay, one more, and then the rest look like they're kind of situational. So we'll follow up with some people on those. Can the procedure pull a modified description?
Can the procedure pull in a modified description? It pulls in the description from whatever is in HST. So as it's pulling in the surgery description, the CPT code description is going to come from whatever's in your library for CPT codes. So, and you could set it up so every time you schedule procedure X, that's the description that pulls in, and then there are some default CPT codes that we always use when that procedure is set up. But like in here, like this description here, typically that is whatever is your CPT description, because that's coming from what that is in there. You can customize some of the messaging and things in here. You can type in individual messages to that patient that you're going to show up in here. So you can customize that a little bit, and you could change that description in the system before you send the estimate out. So you do have some control over how that estimate looks.
Great. Well, thank you both for doing the presentation and demo, and everybody for hanging out a few extra minutes.
That was fun. Thanks everyone for joining.
All right.
Thanks, Lindsay. Thanks, Chris.
Thanks all.